Every night at exactly 7 o'clock, you can hear the cheers from the windows, but public hospital workers say they are not feeling the same sense of appreciation from their employers. Our Ron Lee tells us why.
If we work sick, you get sick.
When it comes to calling out sick, these nurses believe a new policy instituted by their employer, New York City Health and Hospitals Corporation, is both heartless and unfair.
In the middle of a crisis, in the middle of a pandemic where we're fighting for our lives, they changed the policy. Are you kidding me?
Approximately 50 nurses showed up to this rally Friday outside Jacoby Medical Center. Their main concern? To express outrage over a change in sick pay policy that now requires a doctor's note after just one absence instead of 3.
For starters, after all we've given to this fight, this is simply a brutal slap in the face for our efforts in this war. This is a dishonor to our collective sacrifice as public hospital nurses in the most deadly pandemic that we've had in this country in 100 years.
The New York State Nurses Association, which organized the rally, did not provide official numbers for how many nurses have gotten sick from COVID-19. But some of the nurses who spoke to us tell us at least one nurse and one nurse's aide here at Jacoby have died from the virus, while dozens of other workers have complained of COVID-related symptoms.
It is long overdue that we stand up for our rights as protectors of this city. If we work sick, you all will get sick.
And while telehealth visits are considered an acceptable form of documentation, some nurses say as a result of the pandemic, it can be difficult to find a doctor who can provide a sick note.
I'm working with a brace, and if I stay out, I won't get paid because I need a doctor's note. Mind you, the surgeon who's supposed to operate me and cancel my operation told me he can't send me a note right now.
In a memo obtained by New York One, dated April 10th, New York City Health and Hospitals Corporation told workers the new policy is in place due to a high rate of call-outs and absences that do not appear to be consistent with patterns of COVID infections. When we reached out to a hospital spokesperson, they did not comment on the memo. However, they said their, quote, top priority remains the safety and wellness of our fearless nursing workforce. In the Bronx, Ron Lee, New York One.